Thank you so much for joining us today, sir. Today we have Dr. Pradeep Kumar Kaushik, and he's from Narayana. He's a senior consultant and a pediatric cardiosurgeon. So, of course, today we are here to discuss a few things about COVID-19. I have a couple of questions for you, sir, and
Sure.
they're all related to COVID-19, the symptoms, and how we can protect our children in this crisis. So, I'm going to ask you the first question. Um, it's why and how COVID-19 or coronavirus is different from other viruses that are like that causes pneumonia or influenza.
So, coronavirus is a type of infection which affects the respiratory passage.
Yeah.
In other words, it affects the breathing pathway.
Mm-hmm.
So, like the nose, throat,
Mm-hmm.
and the lungs.
Right.
So, it harbors there, it stays there,
Mm-hmm.
and if it is causing serious illness, then it can be detrimental to the patient. Now, how it is different from the common cold and the allergy is that it is very easily spread from
Okay.
person to person. And if the person's immunity is compromised, then it can result into very serious illness. And that's
Right.
why it is different.
Okay.
Now, if you're asking me how the symptoms will be different,
Right.
then the common cold, usually people have mild cough and maybe sneezing or some nasal secretions, what we call as rhinorrhea.
Right.
But if somebody is having high grade fever
Mm-hmm.
with body aches,
Mm-hmm.
like pain in the body anywhere,
Mm-hmm.
and breathing difficulty, then
Correct.
these are the red flags, and one should be alerted as suspected coronavirus
Okay.
until proved otherwise.
Right. So children, right, of all ages will be having the same kind of symptoms, or it might vary. Means children below 5 might have some different symptoms, or children below 15 might have some different symptoms, or the symptoms will be the same.
The symptoms usually are the same.
Mm-hmm.
Some people might have all the symptoms, some might not have one or two symptoms.
Mm-hmm.
But what are the differentiating signs from the common cold or the flu are
Mm-hmm.
the patient should have high grade fever
Right.
and breathing difficulties. These
Okay.
two are very important, and we should not ignore these two. The
Yeah.
others can be managed, or we can wait for a day or two to for them to settle.
Certain.
But if these two are there, then we should immediately rush for the confirmation of the coronavirus, which is done by a swab testing from the throat.
Right. So, talking about the mild symptoms, so what kind of mild symptoms? I mean, we can observe in kids, like, and how long they can be there as a mild symptom.
So usually the virus, it harbors in body for 2 weeks,
Mm-hmm.
and if it is not causing any infection in the body, then usually the patients recover in that much time.
Right.
And mild symptoms, by mild symptoms, I am saying that the patient might have off and on fever up to
Mm-hmm.
100, and they can have cough with some sneezing,
Right. So,
but it's not causing much of body aches. It's not causing much of breathing
breathing
difficulty.
difficulties.
So, yeah, so these symptoms coming off and on for these many days,
Mm-hmm.
these are called as mild symptoms.
Right. So, talking about the breathing trouble or the high fever. So, if the child is loss of appetite is also considered as a mild symptom. If the child is having a cough and cold and fever is like it's not that high, but still yes, fever is there and she's not eating, she or he is not eating well. So, is that also comes under the mild symptoms?
Yeah,
Is
it will come as mild symptom because the kids usually the first symptom for any illness, leave aside the cough, will
yeah,
be that they'll stop eating.
correct.
You know,
So,
if they're not liking it, maybe it's the tummy upset or they have cough or the fever is developing
right.
or some earache, they will just stop taking feeds. So that is usually the first symptom,
Mm-hmm.
and we have to see that how much they're refusing to accept the feeds,
Okay.
and slowly the symptoms will develop, and then we can come to know that what is exactly the problem.
Lovely. So we have seen from the reports that it takes 14 days, right, for the for all the symptoms to come, and or sometimes it's been on the 21st or the 28th days as well. So
Yeah.
why is that like it takes so much of time? The incubation time is so long.
The incubation time is same, but usually it depends on how much each person's individual immunity is,
Okay.
the body's resistance, and
Mhm.
how much you take the time to recover.
Right. So
Yeah,
immunity plays a very important role here.
absolutely.
So now, since after the outbreak of coronavirus, we have seen that people suddenly wanted to have a very healthy lifestyle. They want to eat healthy that can, instantly boost their immune. So for children, do you prefer any specific diets specifically for this time? Uh, which when they they include in their daily lifestyle can improve their immunity system or can lower the risk of getting infected.
So, as far as the kids or adults are concerned, there's no dietary recommendations or restrictions in
Okay.
coronavirus.
Right.
They have to eat anything,
Mm-hmm.
whatever they were eating. There's no need to change their diet,
Mm-hmm.
but they should make sure that whatever vegetables and fruits we are getting, they should be thoroughly washed
Right.
with water,
Mm-hmm.
and the food, whether it's veg or non-vegetarian, it
Mm-hmm.
should be cooked. Any cooked food, you
Mm-hmm.
will not get any infection related to coronavirus.
Right.
It's all a myth that
No.
people are avoiding the non-vegetarian food because
Yes.
you might get coronavirus.
Right.
Coronavirus only gets spreaded by the air,
Mm-hmm.
by the droplet infection. Whenever we are talking, sneezing, or coughing,
Mm-hmm.
it cannot pass on through the meat or non-vegetarian food.
Through food and also the surface, right? So
Yeah,
like in countries where there's partial lockdown, right? So in those countries children are still going to school, or they are still playing outside in the park. So the social distancing is equally important for them as well, right?
yeah.
So, what would you suggest? Like, we should now, since in Singapore, the schools yesterday the PM has announced that the school will be closed for a month now. So,
Oh,
even those in small interactions, like with the immediate neighborhood, maybe, or in the down in the park within the campus, should also be restricted. I mean, parents should keep their children at home, absolutely at home, or what
yeah. So this is what we have to follow. That social distancing means that you have to self-isolate.
right?
So we should not be going even into the society parks. The society can be as large as 500 to 1,000 people.
Yes,
And what is their exposure, and the kids coming from their home. I'm not saying that they are infected,
right,
but you never know. They might be asymptomatic carriers. They might pass on the infection to the
mm,
healthy kids, and they might get infected.
right.
The,
So
the best is to avoid
avoid the.
even playing within the apartment or the society also,
Mm-hmm.
and they should stay home. That
Home.
is the best remedy. But if someone has to go,
Mm-hmm.
then the social distancing, you should maintain a distance of at least about a 3 feet or 1 meter.
3 feet. Okay.
Preferably, yeah, preferably if you have mask, you can put that,
Mm-hmm.
so that your infection does not go to someone else and you also do not inhale those droplets.
Droplets.
And as far as you, as soon as you come home, you should
Mm-hmm.
wash your hands with the alcohol hand rub if available. Otherwise, simple soap and water,
For 20
cleaning.
seconds.
Yeah, hand hygiene for 20 seconds.
Okay.
Very prudent. Yeah.
Yeah. So talking about the asymptomatics, right? So what are asymptomatic is? I mean, who are these carriers who can carry their infection, but they themselves might not get infected?
So somehow what we have seen in this experience of this new coronavirus, that the kids and the youth are less affected as compared to the elderly people.
Right.
But that might be the reason because they are immunocompromised or their lungs already has some problem because of
Mm-hmm.
smoking, asthma, or some allergy.
Mm-hmm.
They have comorbidities, means they have some associated disease like diabetes and blood pressure, and
Okay.
that's why their body is not having that much of resistance to tolerate this virus.
Right.
As far as the kids are concerned, they are a little more resistant, but the time only will tell that why they are more resistant. Still, we have to prove the hypothesis.
Mm-hmm.
But yes, they are asymptomatic carriers because they might be harboring the infection in their throat or in the body,
Right.
but they are not showing the symptoms. So if they are not showing the symptoms,
Mm-hmm.
then we call them as asymptomatic carriers. Symptoms means the complaints.
Okay.
So if they are not having the complaints, but if you take the throat swab of all the kids, you might find many coronavirus
Okay.
subjects.
Okay.
So those are called as asymptomatic carriers.
Okay. So they won't be having any difficulty since they are not showing any symptoms. which means the virus is not affecting them. I mean,
Yes.
they are totally unaffected by the virus, so they won't be having any side effects or going forward
No,
in future, no problem,
no, no,
no issues.
no. They won't be having until unless the kids who have born with some immune deficiency. There are certain diseases which in which their immunity is less,
Right?
or they have some cancer,
Mm-hmm.
or they are on steroids
Right,
because of some other illness.
right.
Then these patients' immunity is less,
Mhm.
and these patients, if they are asymptomatic carriers, also they can become symptomatic any point in time.
At any point of time. Okay.
Yeah.
So, yeah, talking about the health conditions, right? So, sir, I want to know, like, children with, with health conditions, right? If they had any previous health surgery, or they're allergic, or they might have any respiratory problem like asthma, are they more prone to the infection compared to the other children?
So someone who has undergone heart surgery or any other surgery in the body, like say hernia or appendix, they are not prone. They are as good as any other individual or any other kid, healthy kid.
Mhm.
And there's no susceptibility or there's no increased vulnerability for coronavirus.
Okay.
But yes, the patients who have asthma, they might have increased propensity because it might affect their lungs
Mm-hmm.
and their breathing is already compromised. So they might get affected a little more chance of getting affected as compared to the other patients who have undergone any other surgery.
Right. So the immunity is very important. I mean, we should have a good immune system to fight against the virus, be it coronavirus or be it any other virus. So, do
Absolutely.
you prescribe any substitutes, like apart from our food that we intake or food that we give to our children, any substitutes like vitamin syrup or vitamin C syrup or D that can help not only during this crisis but also going forward? Should they take? Regular intake should be there.
I mean, the kids, whatever your pediatrician is recommending, they can take. Otherwise, the normal food, if they're eating a healthy, complete diet,
Right.
of vegetable, pulses, and non-vegetarian milk, curd, it contains all essential elements and vitamins. You do not need to supplement anything.
Right.
And for this coronavirus, also, you do not need to take anything for your immunity booster. And
Okay.
nothing is as such available also in the market which can give you some immunity against this particular coronavirus.
Yes.
And leave aside this coronavirus, also, we do not recommend anything for immunity booster.
Immunity boosters. Okay. So there's a common myth going on, like the hot temperature or taking a shower in a hot shower might help. So, what do you want to comment on that?
No, these are all myths.
Myths.
You can take any normal water would do for hand hygiene or for taking shower.
Mm-hmm.
There is something else going on around that the hot climate also protects you from
Yes.
against coronavirus. So that
Yeah.
is also a myth.
Okay.
And yeah, it does not help you.
Right. So, from now, this is a question from one of my friend. Like, she's a new mom now. So, are there any chances where a mom can infect a baby? I mean, the antibody can be transmitted to the baby through feeding, breastfeeding.
No, so it does not get transmitted if you are feeding your kid.
Okay.
It can get transmitted if mother is infected. It can infect the kid when they, because anyway mother and child are close
Yeah,
by.
I know.
So it can get transmitted by through the breathing or from the airborne, like
Yes.
air, but it cannot get transmitted by the breast milk.
Okay. So, yeah, these are the couple of questions that I had for you. So, from your end, would you like to, add something for the viewers, like basic preventions or measures we should take as parents to protect our children?
Yeah, so I would just say that as we have already mentioned, just to summarize, that we should have social distancing
Right.
and no handshaking, no
Mm-hmm.
hugging.
Mm-hmm.
You can just say hi, hello, or wave the hand,
Right.
and you try to protect yourself by wearing a mask.
Mm-hmm.
Avoid the crowded places or the people who have suspected coronavirus.
Mm-hmm.
And as soon as you come home, whatever things you were carrying, like your bag or laptop or a wallet and pen and mobile,
Mm-hmm.
you should clean them with hand rub solution
Okay.
and wash your hands for 20 seconds.
Right.
And wash your hands as frequently as
As
possible.
well.
I recommend this for the adults and for the kids, everybody.
Right.
And yeah, so
Mm.
this is all what we can do to prevent getting coronavirus.
Sure. So thank you so much. It's I won't hold you back. I know you have a busy schedule. So thank you once again, Dr. Kaushik. It's been a wonderful speaking with you, and the
Sure,
information that you shared, I'm sure is going to be benefited by everyone.
sure.
So thank
Stay home, stay safe, stay healthy.
you too. You too. You too. Yeah.
Thank you.
Thank you so much.